What's up everyone? My name is Christine and I have common variable immune deficiency. In today's video, I am going to talk about what to expect when getting your IVIG infusion in your home. I've already made a video in the past talking about CVID treatment, IVIG versus sub-QIG, and some of my experiences with it. And I have also made a video as to what to expect with your first IVIG infusion, but this video is going to be specific about what to expect with getting your IVIG infusion in your house. Before you get home therapy, your doctor will write the prescription to a home health pharmacy. I know my immunologist had a very good awareness of which insurances cover which specialty infusion pharmacies, and he already knew which pharmacies he had to send off the referral to. If your doctor does not know which pharmacy to use, your insurance should give you this information. In my experience, people likely do not have the choice as to which pharmacy they can use. It is usually only one option from your insurance, but if you have the choice, that is really awesome. I have never heard of that, but you know, healthcare is great here. That aside, you will be paired up with an infusion company. There are pluses and minuses to all of them, just like everything out there. I have used several different companies through the years. At no choice of my own, it's always just been whatever my insurance company is covering. Before you get your first infusion, you're obviously going to get a call from the infusion company that's going to ask you some intake questions, your height, your weight, your past medical history, all that fun stuff. And then they will select a date to send a shipment of your medication and the supplies. Some companies require for there to be a signature, somebody at the house or the apartment, wherever, to sign for the medication in order to drop it off. This is a reasonable expectation because this medicine is very, very expensive and they do not want someone to claim that it was never delivered when in fact it was. I did not ever have a problem with telling them to leave it at the door, but I had to specify saying it was okay to leave it at the door. If you live somewhere where you do not feel comfortable leaving it at the door, I would not do that. This is very, very expensive stuff and you do not want to have it stolen by somebody who has no use of using this medicine. What are you going to get? In your first shipment, you are going to get a lot of supplies. After your first shipment, you will not get quite as many because obviously some of them can be reused. What are some of the supplies that you should expect to receive? Well, obviously you're going to get your medication and then they are going to send the supplies. It is typical that they will send more supplies than you need. They would rather you have an excess in case you need to use more than you expect than to have the nurse at your house ready to do the infusion and one set of supplies went wrong and now they have nothing and they can't do the infusion. So in my experience, companies can go a little overboard with sending their supplies. I get it. But just as a warning, you may at some point have to do supply control. I have been trying to do this for years. With my current, this is totally off topic, but a sub note. With my current sub-Q supplies, I literally tell them I need this number of this number of this, and they send that number of stuff, but they still send all the other stuff too that I did not ask for. And I'm like, I'm really trying to control things here, but whatever. You'd rather have more supplies than not have enough. What else are they going to send? Well, you're gonna get a handy dandy sharps box that should come in a box like this for you to mail once it is full. I obviously have not done a good job at that because I can't even tell you how old this sharps box is, and I should probably mail it. The sharps box comes with a return label, which I have a lot label on top of here. I don't know what's going on. But I can tell you the company that has the return label on this box, I have not used in several years. In your return label box, you will obviously have a sharps box. It'll probably come in a plastic bag that you can put the box in when you return it, because I'm very on top of that. And then you might have a sharps box that looks like this. Kind of, I don't know, looks like a gas thing to me. It's self-explanatory. It has a fill line. You don't want to fill it past that line. I really need to return this thing. This thing is super old. It is not at the fill line yet though, so I could still use it, but yeah. That's the Sharps box. Sharps box do come in all shapes and sizes. I have this one, which I'm not in love with because it does not stand up very well. The other thing that you will be getting, which is an unusual thing to have in your household, is an IV pole. So this is my IV pole. Let me try to get a better shot of my IV pole. This is the IV pole that I have. It is a very old IV pole. It is kind of really hard for me to believe that it was over a decade ago that I started all of this. The IV pole, at least this one, does fold up and collapse, so it makes it easier to store. You just kind of twist it, pull it down, something like this. Ugh. These little hooks are to hang the medication off of, and depending on what kind of pump, which is the next thing I'll talk about, they may or may not have to attach the pump to the pole. But anyways, this goes down like this. Tighten this up, and so it's much shorter, it's easier to store. Back to what I was saying about the pump. There's a lot of different IV pumps out there. I don't think it's very common for them to just drip the IVIG because it is really a medication where you want to control the rate. You do not want to pump this medicine out as fast as you can because the faster it is infusing, the more likely you will have a reaction to it. And especially if it is new, they don't want to be doing the fastest speed as possible. So just keep that in mind. If you do end up getting a home health nurse that seems like her interest is to get in and get out, discuss the rates with your doctor so you kind of have an idea of what to expect, but you don't want to just be blowing this medicine as fast as possible. There are different types of pumps, like I said. There are very small, cute pumps. You might get one of those larger pumps that you kind of think of when you think of at the hospital. I did have the larger pump at some point in my infusion history. We actually attached it to this little tiny IV pole that I have here, and I do remember one infusion when I was in college. That pump was so heavy, it just fell over one day with my arm attached to the IV line, and the pump broke. So I'm not a huge fan of those huge jumbo pumps. Hopefully in today's world they are going for those little smaller cute pumps that you can kind of just lay on the seat next to you while you do your infusion. Otherwise, the other supplies that you are going to be getting is probably an EpiPen, just in case you have an allergic reaction. My doctor to this day is always asking me if my EpiPen is up to date and not expired. I have so many EpiPens. This is actually a really good question. What the heck do you do with your expired EpiPens? I don't know what I've done with mine in the past, but I can tell you I've probably got a lot laying around right now that are expired. But yeah, you're gonna get the EpiPen, and then obviously you're gonna get all the IV supplies that you need for an IV. You're gonna get the needle to start an IV, the IV line. As far as getting IVIG done in the home, one concern that I do remember my doctor saying when I was first diagnosed, and this is more so for children, he didn't have a huge concern for me because I was already 17 when I was starting treatment. But for any parents out there, something you might want to think about is with being a child, it may be traumatizing to have to get a medical treatment in the home. So like I said, I remember my doctor said sometimes for his younger patients, he recommends having the treatment in a hospital because you don't want that negative association of the treatment and the home to collide. Because it could be traumatic for a child getting the IV, and it could not be a positive thought, and you don't want that to be like their bedroom where they're having this experience. If you're an adult or an older child like I was, it shouldn't be so much of an issue. It never really was a problem with me. I was old enough to know that this was medicine that I needed, and it wasn't any associated trauma. Otherwise, I think getting the IVIG at home is such a wonderful thing. It is definitely convenient. You don't have to drive anywhere, you don't have to park anywhere, you don't even have to worry about driving and potential side effects from your medication that could happen. That could result in you not being able to drive. I know some people really develop awesome relationships with their home health nurses. I had many good ones in the past. Like I had said in a prior video where I talked about my experiences, towards the end of my IVIG journey, before I switched on over to sub-Q, I had to get IV Benadryl with each infusion, and that would have been a pain in the butt to have to rely on somebody to drive me home after each infusion. And even like when I was in college, I would have had no one to drive me to and from my infusions. Back when I got IVIG in my house, I was able to just sit back and relax in whatever room was comfortable for me. I was able to lay on the couch in the living room if I wanted. Sometimes I laid in my bed. Sometimes I really would just sleep the whole infusion, especially when I was getting the IV Benadryl. And yeah, so just wherever you are comfortable, it's perfectly okay. IVIG can be done not only in the home, like I have talked about in other videos. I got IVIG when I was off in college, so I got my IV infusions in a dorm room, which was really fun, and in an apartment when I was away at college. So those scenarios do come up. It is possible to make it work out. I hope this video is helpful to anyone out there who might be starting IVIG or who might be transitioning from getting IVIG in a hospital or clinic to the home, whether it's your choice or your insurance's choice. I hope you enjoy the rest of your day. Bye! But they will usually send you the supplies for at least 1 month worth, which if it's IVIG, it's usually just 1 dose. I'm getting a little confused with the sub-Q for a minute. Hold on.